This is a cardiac ultrasound. There are 10 clips that we're going to go over. This is an oblique parasternal lawn. A couple things you can look at this. First off, just because of all the amount of cardiac ultrasounds I've done, the LV looks a little bit thick. That would indicate to me LVH, not necessarily the cause of the patient's symptoms here. I'm having a little trouble, I think, because of the rib shadow that comes into view and looking at the mitral valve. It's hard to tell from this view if the ejection fraction is intact. I think it is, but I wouldn't really make a clinical decision from this view. Similar story here with the rib shadows coming into view. Really hard to make a complete 100% decision if the EF is intact. Between these two, I'm leaning towards it is have a normal ejection fraction, and you'll look at the later views, it's a little bit more clear. Same thing here with the rib shadow and oblique axis, hard to tell. Here we have a parasternal short, and I think this is a very nice clip. I think it helps us give the information that the LV is intact. I see all the walls coming together, and the left ventricle is clearly much bigger than the right. So just this one view here, I think, answers the question, how is the ejection fraction? How does the left ventricle compare to the right? And is there fluid around the heart, which I do not see? This is a parasternal lawn. Now here, I think your angles are much better. We have the LV here, the left atrium, the aortic outflow tract, the RV. Again, the images come and go, so hard to see everything in one continuous clip, but you do see the walls pretty much touch. So I think this is good enough to definitely see there's no pericardial, that there is a normal ejection fraction. You have your descending aorta here to help illustrate that there's no pericardial effusion. We'll keep going down the line. This is kind of a cross between an apical 4-chamber and a parasternal short. Because there's so much movement, hard to make a clear clinical decision. This is a nice parasternal short here, kind of in that cross movement view that you had in the previous clip. I think this is nice and does illustrate nice consensual contraction of the LV. Similar story here, a little bit oblique, but you see the walls come together nicely. And then this is your final clip here, which is an apical 5-chamber. You see the aortic outflow tract coming into view. It's a little oblique, so hard to tell the LV versus the RV ratio, but with all the other clips saved, I think that the LV is definitely much bigger than the right, and so you don't have to worry about as many pulmonary pressures like a PE or pulmonary hypertension. So hope this helps. Thanks so much for saving. Let me know if you have any questions.